What are some other like tips or tricks that you have to keep the culture in the workplace where people want and enjoy to come to work?
So I think part of that is you have to want and enjoy going to work. I genuinely love being at the urgent care. I love it. I've created a space that I would want to work at, and I have worked at every day. It's clean, it's organized. So a little background about the urgent care as well is it's in the neighborhood that we live in. So we are literally taking care of our neighbors, and I love that. My husband loves that. We're happy to be there. Patients walk in and everyone gets greeted the same way. Hi, welcome. How may I help you? I think leading by example and being there and treating your patients and your staff the way you want to be treated and the way you want them to treat other people is key. I don't care what's going on in your life. You can come to work and still maintain a positive attitude and take care of people. With an urgent care, people are coming into us no matter how silly the chief complaint may be. Mm-hmm. They're coming to us because they need help. Yeah. We are in the business of helping people. I love it. I've always loved the nursing and the patient care side. But what I think is important to lead with and to show staff is that starts the moment a patient walks in the door or the moment you answer a phone call. That is the patient care experience.
You're setting that and with your patients, with your staff. Exactly.
I am very methodical. I greet every patient the same way. I answer the phone the same way. Hi, thanks for calling, All Valley Urgent Care Mesa. This is Krysta. How may I help you? I'm big on scripting. You and I have had many discussions on that. I think that, I follow the script. So, and the staff can hear that.
Yep.
I answer the phone the same way. I greet the patients the same way. I'm happy. It comes from a genuine place because I genuinely love being there. So I think that's important. You have to be the culture that you want from the get-go. It starts with the very top. And if you're not happy to be there and you're stressed or you're letting, the bills and the whatever with owning a business stress you out, everybody can sense that. Mm-hmm. Your staff, and that trickles down to your patients. I want everybody to be treated like family and how I would want to be treated or a family member to be treated. And I think we've done a good job with that. I think we've built an incredible team. I'm very proud of everybody that we have working with us, and I would trust them to take care of my family and my neighbors, obviously, and my friends. Yeah. And nothing makes me happier than having a friend call and say, hey, I went into the urgent care today and everybody was great. And, they were all happy. And
yeah,
that tells me that I'm doing my job. Nobody's perfect, and I'm not a perfect, leader by any means, but I do feel like you have to be what you want for your business. And it starts with you.
It starts with you. And I think setting that example with your staff and making sure that they understand, the expectations. I do want to go back to the scripting and the policies because I do think that's been a big part of what we've done together over the last 6 months.
Yes.
You've kind of identified the workflow issues. We've worked on some scripting and some policies and procedures, but I do think setting that standard of how you achieve and do certain things. I know eligibility has been a huge part of your workflow. Obviously, I think denials are much lower than what they were. Are they zero? No, but they're improving. Coordination of benefits and eligibility is it's just a lot in the urgent care space, and with lots of changes, right? It's just a different environment. Yeah. And so you guys have worked really, really hard to put in those places, not only at one of the locations, but at all the locations.
And I think, just to touch on that a little bit more, you're going to have denials, you're going to have issues. I don't think we'll ever get to
totally
zero because there's human error. And even with the emergence of AI, we're still noticing that's not perfect.
Right.
What I think has changed for us is now we have a system in place that is tracking these errors and identifying common errors. So now we know how to help the staff improve and hopefully avoid those errors moving forward. Previously, we were getting, this is the error, this is the error, this is the error, but it's like, okay, well,
what are we doing about it?
Is this a one-off thing or is it regular? Now we know, okay, we had this many errors because of this reason. It was this person doing it. Okay, we need to now go back and do that. And I'm constantly working with Mandy, our billing manager, on ways, how can we improve this? How can we help the staff? How can we educate them? What am I doing wrong? And explaining this to them. Or how have I fallen short with my staff and getting this information across to them so that they can improve and do better. And I think, meeting with another urgent care operator, yeah. I think maybe we've got another thing to try that we haven't tried before.
Competencies.
So,
which is funny because we do competencies assessment in healthcare all the freaking time. Like you and I, how many times have we had to do either competency on a staff member or, in the lab world, like we do competencies. It's a regulatory requirement. Like we have to do competencies all the time.
And we have competencies, but just not for front desk.
Right.
And I met with this other amazing leader and she's like, we have the same issues. Here's what we did. And she created this quiz that was beautiful.
Amazing.
And I was like, this is like, now that I've seen this is like, why didn't I think of this sooner? Because like you said, we live in a world of competencies.
Right. It's healthcare. We've grown up with competencies. And it's funny. I mean, yes. And we have all the checklists, we have policies and procedures, but I do think taking that one step further, not only from a competency assessment of making sure the staff understand, but also setting the expectation that, you need to learn this and understand it. But then also kind of one step further, which is just that ability to, have documentation around how a staff member is doing. Which I think just helps the organization plan for the future better and understand, right person, right seat. You've talked about like making sure that everybody understands their role, but also is that the right role for them? I mean, you've done some moving around of people who maybe previously were in the billing roles who've moved to different roles, and that's been a good fit because you've understood, okay, what is their skill set? What are they good at? What do they like to do? And can we mash all of that with what the business needs and put those people in the right seats, which is really important.
100%. I think if you give your staff enough space to work and have some autonomy, you have guidelines, you have policies and procedures, you have some scripting. But if you kind of just sit back sometimes and observe and listen and watch, you can pick up on their strengths. And sometimes it does mean moving people to a different role or adjusting their current role or noticing, oh, wait, you were doing stellar. You had no errors and now you're having all these errors. What's going on?
Totally.
And you have a conversation. I'm like, are you bored? Yeah, I'm bored. Okay, well, let's give you more.
Yeah, like let's.
I'm happy to give you more.
You're good at this.
Let's challenge you.
Let's have you delegate that or have that be 10% of your role, and let's give you something harder to do. And here's what the business needs. And are you do you want to do that? And you've been able to do that. And I think that's an important part of leadership is really looking across your team and going, okay, what are you good at? What can I help mentor you on? what skill set do you need to go to take that next level? And then here, I'm going to give you the opportunity to grow. And it's okay if you fail. I'm here to catch you, but like, here, go.
I think that's like exciting.
Yeah.
That's what really gets you going. And then that gives buy-in with your staff and gives them a sense of ownership in their role, which ultimately translates to better customer service, better patient experiences, which translates to word of mouth business. We have done no advertising at all, and we're full every day.
That's amazing.
So, and it starts with your staff, and it starts with you. You're included in your staff as well, and it's exciting. It's fun. It's not without stress, and hard work, but for me, it's been the greatest time of my life and my career. And it's just been awesome. And I think more people should go into business for themselves and take that leap.
I love it. I mean, and I think that, that's one of the reasons why we do this podcast, right? To educate on the topics. But I think hearing from different leaders about how you've built your business, how it is hard. I mean, not sugarcoating this, right? Like you were working. I mean, when we first started talking a year ago, you were, I think, literally at one of our conversations sitting in the front desk and managing something. And then you had to kind of step away so we could have our conversation. So, but that hard work led to where you're at now. And yeah, you're still continuing to push and to grow the company. And that devotes time that you need to put into the business, but you enjoy it. And you've showed that you're enjoying it to your staff. And again, I mean, just watching you guys operate your business with your team members, watching you guys kind of move people around, watching the business grow and opening up kind of new segments of the business has been really cool. Mm-hmm. And I think you guys embody that leadership that I think a lot of people just want to have that skill set as well. And so I'm hoping that, in doing these podcasts with the interviews that, the listeners are taking away like some of those tidbits of things. Okay, go sit in people's roles, work on policies and procedures and scripts, understand where people, are best suited in terms of role fit. And then again, it's back to what you said. It's setting that example. Like what do you walk into the office portraying every day? If it's stress and concern and worry, even if those are legitimate fears and legitimate feelings, turn it around, show the staff that you can be positive, and then deal with the other stuff, as it comes.
I thought of another important thing. I think that's really valuable is you don't know what you don't know. Mm-hmm. And it is 100% okay to have an idea and to think you kind of understand something. And then the more you educate yourself and the more you learn, it's okay to say, oh, wait, I was wrong.
Yeah, totally.
And let's change course. Let's adjust our trajectory now. I've done that many times in different roles as a leader. You can think of a process. You can think what you're doing, oh, eligibility is not important. It doesn't matter. Whatever. Like, we're just going to ignore that. And then be like, hold on. That is the most important job. You are the most important job or role in this whole process. We have to get it right. Here's why it's important. And then showing them that I'm constantly changing course. Oh, we thought this was a great tool. It sucks. Let's scratch that and go back to the drawing board. I think you have to be flexible and have a very fluid mindset that you're going to try something. And if it doesn't work, it's okay to say that did not work.
Yeah, it's a pilot. It's a pilot. You're trying it out. If it works. And again, you do that with some education. You do that with the input of the team. But again, that is part of a small business. I mean, and even a medium-sized business. Heck, large corporations, gotta love a pilot. So, but I think it's that iteration of here's where we want to be. Here's where we are. I think these three things could potentially work. I'm going to try one, see if it works. Or if it doesn't, then I'm going to move to one of the others. And, but I think you're right. I think having that flexibility, getting that team dynamic input, but at the same time, like constantly just moving the team into, a further a further progression for the business.
Yeah, and then tracking it,
and tracking and measuring it,
looking at the data. I love data, so I don't make a lot of decisions without having data to support it as well. And that's hard for some people, but you have to be willing to look at the data and look at how things are working and change course, or go, oh, that didn't work out as well as I want to.
Nope.
Let's change course. Let's put this person in this role. Let's adjust this. Let's do this. So you're constantly evolving, and I don't want to say looking for the next best thing, but looking at ways to optimize and improve efficiency and ultimately improve the revenue.
Yep.
We did not start this business to get rich or make a ton of money. We really wanted to help people. This is kind of our end game of our careers, and we wanted to do something to give back to the community, but we need to pay the bills and have money to pay the staff. And that comes from
revenue,
doing all of these other things, so, it's fun. It's a wild, crazy process, and don't be afraid to ask for help and to talk to other people. Other business owners are not scary people. Most of them are willing to help. And I think more people need to talk, and more people need to get together and share ideas and work together to help grow other businesses and help support each other.
Well, and I love that you're already doing that with other people that, like, some people will go, well, that's my competitor. They're doing the same thing. But if you look at it as, we're all in this together, like, you can have, your locations, I can have mine, and we can still help each other grow and be successful. I think is a good way to do it. It's been really fun watching you guys, build your business. And again, we walked into it where it was already, a very successful business, but seeing all the things you're putting into place, I think it's just really inspiring. And you've truly gone from clinician to business owner to, major operations over a large organization. We've worked on culture, you've worked on policies and procedures, you've changed RCM. Like, you've legitimately, you've done a lot over the last 12 months that I've known you anyway. So
yeah, well, it's been fun. And I think finding, the people that can help you get there is key as well. When we first started communicating, you were like a mentor to me, and I saw you as this successful, businesswoman, and here you are, you took this area that is so confusing and so challenging and so daunting and made it easy to understand and approachable and fun. Like,
who doesn't love a good spreadsheet?
You did that.
Who doesn't love a good spreadsheet? A spreadsheet.
Who doesn't love a good
It's great.
I love spreadsheets. I love numbers. I love all that stuff. So, you have to find the people that will help elevate you, not only personally, but with your business. And don't be afraid to come up with other ideas and to just keep evolving and growing. That we've got other stuff in the works, and how we can improve our business and continue to grow and expand. And we have that partnership. I really do feel that we are in a partnership together, that any crazy idea I come up with, or, Dr. Tyson comes up with, because he's a visionary and comes up with these ideas and wants them done, that I can reach out to you or Mandy and we're like, okay, well, let's figure this out.
Let's look at the numbers. Let's do the business case.
Let's look at the numbers.
Let's think about it.
And
that's like an important part of this, is finding the right partners. We're a big proponent of, we are not your outsourced vendor. We are one with your team. It's just been great working with you guys. And I appreciate you coming onto the podcast. I know that it's not easy coming and sharing your story. Just appreciate you coming on and chatting with us today. Any last words of wisdom for the listeners as we close up?
Geez, that's a tough one, Heather. I think just don't be afraid to jump in and do the work. I think, for so long, my husband was afraid to make the change and to jump in, even though he had been doing it, working for a large health system before. And don't be afraid of a challenge. Don't be afraid for the roadblocks and everything that comes in your line when you're starting a business, and involve the right people. And if you have a gut feeling that the people that you have aren't the right people, don't be afraid to make a change.
I like that. Yeah, it's not easy making changes, but look at where you guys are at now. So, well, again,
Yes,
thank you so
and
much
we
for being
appreciate
on,
you.
and thank you. And for the listeners, hopefully this story, resonates with you guys, that you guys can kind of take some of these process improvements around working with the staff, finding the right seats, putting in the right processes in place to improve your business. And of course, if you do have any questions or want to reach out, head on over to natrevmd.com or shoot us an email at info@natrevmd.com. Thanks so much for joining this week.